Today's webinar is being presented by our Family Care Coordinator at the Johnson Center, Jeanna Martinez. Jeanna received her Bachelor of Arts in Psychology with a minor in Early Childhood Intervention from Texas State University. She then went on to obtain her master's degree in Family and Child Studies on the Child Life track. She completed a Child Life practicum and Child Life internship at Christus Santa Rose Children's Hospital in San Antonio. While there, she was placed in the hospital's outpatient clinic, as well as completed her internship rotations in the GI unit and emergency department. Jeanna is currently a certified child life specialist and is trained in childhood development, special education, early intervention, family systems and stress, and developmental disabilities. Jeanna has experience working with children and families in various settings, including residential facilities, educational facilities, and children's hospitals, providing emotional support to families during stressful life experiences. Before we begin the presentation, please note that questions can be typed into your control panel throughout the presentation, and time permitting, they will be addressed at the end. Now please welcome Jeanna.
Hi everyone, I'd like to start by thanking everyone for attending. I am our Certified Child Life Specialist here at the Johnson Center. Today we will be covering a lot of information, so I apologize in advance if we are unable to answer all of your questions at the end of the webinar. Feel free to email us and we'd be happy to send you more information or answer any additional questions. So the purpose of this presentation is to learn about simple strategies that can help children with autism cope through medical experiences while also reducing the stress and anxiety felt by parents. The information presented today can be used within the medical environment as well as prior to the child's arrival to effectively support children with autism in the medical setting. And after becoming familiar with some of these strategies we discussed today, we hope that you will be better equipped with the knowledge to become familiar with the unique characteristics and challenges patients with autism may face. So we know that children with autism are likely to experience challenges in communication, routine, and social interactions. As parents and clinicians, it's important to implement techniques that can support these areas of concern. And so today we will discuss strategies you can implement prior to your appointment, during your medical visit, and then discuss future considerations. And so we'll start by talking about how to prepare for your visit. The most important thing for parents is to gather information from your healthcare provider or healthcare team about the procedure or the event. The more information you know, the better. This will help not only the patient form expectations, but parents as well. Some hospitals or clinics have preparation books or videos that you can watch prior to the experience. You can also ask for a tour of the facility or a picture online that may help prepare your child for what to expect. Some children may fear setting foot in the hospital setting or in the office or medical setting, so by providing pictures of the facility or touring, children can form positive expectations, which will make returning to the hospital or the medical clinic easier in the future. And below is an example of our picture story that you can find online where we've outlined what to expect from our facility when you visit the Johnson Center. And so we'll briefly go through this. You can see that it is on our website and it's under a visit to the Johnson Center. And so what we've done is basically outline every step of what to expect from beginning to end. And it's outlined in a very family-friendly, kid-friendly way. We have our mascot here, JC, and it's actually JC who's going to take you on the tour. And so this is a social story you can use to help prepare children for the visit. And you can read this story together before the actual visit, and then you can bring it along with you as you tour. So you can see that we've kind of taken pictures of every kind of different experience that you will have. So from beginning, when you drive into our office, you can see what the building looks like. You can see what floor we're going to be on. And then he says maybe you can press the button, so a way for the child to be involved. And then what's really important that we've done is gather information on who they will see and who they will meet, the team members that are going to be there to help the children and the patients. And so here JC outlines the first person you will see is our front desk manager, and her name is Courtney. So you give it a more personal experience, and they're able to put a face with the people that they are going to meet. And then we've actually outlined the different rooms. That way when the children come in, they've already seen them and they know what to expect. And then the biggest part here is that we've outlined our play, so they see that there's something exciting and fun to come and do here. And then we also talk about, like I said, who they'll meet. So JC says here you'll meet Jeanna, our child life specialist. She will help you along your visit. And then you'll also meet our nurse, Rebecca, down here. And this is a really important piece because you can see a patient that's actually with our nurse. And it says you may meet her. She can measure your height and see how tall you are. And so if this is something that they're going to experience, they've already seen another patient kind of go through that, and it's less intimidating. The nurse may ask you to sit in this chair. The nurse will wrap a cuff around your arm, and this may feel like a tight hug. So if they're going to do any type of vitals, if the clinic tells you that that's something that they're going to do initially, this way you have some language to use. And then JC says, see you next time. And this is something, like I said, that you can bring in beforehand, or you can bring during your visit, then you can take with you and be able to bring it back the next time you visit. So next we'll be talking about different coping strategies that you can use, again, prior to your visit. To determine what your child's best coping strategies are, you can kind of use some different examples and see what works best. And some of the ones that we've included here are the use of distraction or the use of a transitional object from home. So if they have a special toy that they really like, or a blanket, or a book, something that they can bring from home and then use it here in the office or in the hospital. It's a safe object and something that not only can, if they have a positive experience in the hospital.
Welcome to GoToWebinar, Web Events Made Easy.
Visual support guide, which we will discuss later in the webinar. So any comfort measures implemented benefit the child today, but really more importantly tomorrow. So what we're trying to do is build a positive medical foundation so that the child's future medical experiences can be positive as well. So it's important to communicate your coping strategies with your healthcare staff so that those support services can be used during your procedure. So if you know that there is a special video, or if you know that the child likes to use games like I Spy, you can talk to your healthcare provider before the blood draw or before the visit or whatever experience you will have. That way they already know to put those support strategies in place for you. And you can talk to somebody that you've built that rapport with, or somebody that you feel comfortable, like a nurse, child life specialist, or social worker, and then they can help communicate your coping strategies with the rest of the team. And this person can work then to provide those transitional supports and then help you along with your visit. So what we'll talk about next is a social story. So the tour kind of give you a brief outline on what a social story can be used for a visit. This social story that we will be discussing next is more specific towards blood draws. And so many people use social stories to explain situations that may be confusing or scary or new. The social story can help your child understand the experience, which may decrease their stress and anxiety regarding the medical experience. And so below we will discuss the example of a social story that we use for blood draws. And again, you can find this information on our website, or you can create your own using some of the techniques that we talk about today. So for parents or professionals, this is a story that you can use to outline what to expect during a blood draw, which can be intimidating and can be a little fearful for some of our kids who may have had a negative experience in the past, or for some that this is the first time they experience this, and so we want to be sure that they have some great expectations. So this is what you can use to prepare your child for the visit. You may use this story together before the actual visit. And here we've outlined what you can actually do to reenact this at home. That way they've already experienced this. So you can use a doll, a rubber band for the tourniquet, a wet cotton swab for the alcohol wipe. And this way your child becomes familiar with the supplies that they are going to see, and they have some expectation. The first step that we've outlined is what to expect when you first enter the room. And so what we've actually done here is use age-appropriate terminology, and we'll discuss how important that is. The wording can be very useful depending on what you choose, how you choose to explain it. And then we've actually taken a picture of the experience using the exact materials that are used and our nurse Rebecca, who they will see. So the first story here is I'm going to have a blood draw at the Johnson Center. The nurse will ask me to sit in a chair that looks like this. The nurse will wrap a band around my arm, and this may feel like a tight hug. So again, we'll talk about appropriate terminology, but what we've done here is change the wording of tourniquet to a wrap, and we've explained what the wrap is going to do. For some children, they may have never seen a tourniquet before. They don't know the purpose of it. They don't know what to expect, if it's going to hurt or not. So being able to play with the wrap beforehand can be really useful. They can wrap it around a doll. They can wrap it around the nurse's arm. They can wrap it around the parent's arm, so that way they know that it's not harmful. The second story is the nurse will use a cold wipe to clean my skin. And again, we've outlined here that this will not hurt me. And it's important to reinforce that. That way a child knows that it's not going to sting, because that may be something that they associate the alcohol swab with. The nurse may also spray something on my arm or use other things to make me feel better. And we'll discuss at the end of the webinar some pain management, but this is a way that we briefly talk about this to let caregivers know that there is some form of pain management that will be offered. The second story is while the nurse is looking at my arm, I can watch TV, read a book, look at a video, and sometimes it helps to talk to my mom or dad about some of my favorite things. Someone can even give me a big hug to help me stay still. So this is actually one of the most important pieces of the social story, and we highlight several different areas here. The first is distraction. So what we're talking about here is while the nurse is looking at my arm, I can do different things. So we're actually giving them responsibilities. We're giving them options. We're letting them know that they can actually have fun during this time. They can do things they like. And then, of course, what we can utilize is that preparation material. So if we know as a clinician that they like a certain video, we can put that on beforehand. And sometimes it helps to talk to my mom or dad about some of my favorite things. And we'll outline guided imagery later on in the webinar, but this is kind of a highlight of that. So if the child likes going to a walk on the beach, or if they like to play at a theme park, that's something that we can pull to use as an aid to start communication. And then the last piece is, and again we'll talk on comfort positioning, but we say here someone can help give me a big hug. I apologize if you see this pop here. So what we talk about here is the big hug. A big piece that we need to address as clinicians is the fact that children may fear being restrained or held down or not being in control of their body. Another piece is that we're giving caregivers the responsibility and a role in that experience. So we're allowing mom, dad, or whoever is bringing in the patient to actually be a part of that experience and to help provide that comfort that a child will trust and will need at the time. So instead of having them sit stationary and having strangers hold them down, we're actually asking the caregiver to give them a big hug and then reinforcing that to the patient and saying, I want you to give whoever is holding them a big hug as well. And then we talk about what the patient's role is. So it's important that I do not move. My mom or a helper might help hold my arm to help keep it from moving. The nurse will press down on my arm and I may feel a pinch. The nurse needs to take some blood to make sure I'm healthy. I can give some blood away because I have lots of blood in my body. My body is so smart that it quickly makes more blood. So again, highlighting different developmental areas of concern here. One of them being the control over their body. So a child may fear and be more anxious when, like I said, they are restricted. So if you give them a role and explain why we need to hold still, they may be more compliant. You may have a child be less anxious, which can be very helpful during that blood draw. The second part that we are addressing is the fact that for some children, they may have a misconception that we are draining their blood almost like a vampire. It's something as a clinician we may not think about when we're doing it. It's something as a parent we may not realize. And if a child, especially a child that is on the spectrum, may not have the verbal ability to communicate that fear. So we as clinicians and caregivers should acknowledge beforehand, make sure you reiterate that the blood, even though it's being taken out in the blood draw, our body is so smart it's making more blood. And then the last part is that the nurse is finished. The nurse will put a Band-Aid or colored wrap over a piece of cotton and I can choose which color I get. Again, giving them choices, making them part of the experience. And then the last part, which is a favorite to all, is the patient that's smiling, the caregiver that's smiling, and everyone is proud of me. We are rewarding and reinforcing that they did a great job. And at the bottom here we have added a visual schedule. We'll briefly talk about that later on, but it's basically an if and then. So first you'll see the nurse push up your sleeve, put on your tourniquet, feel pinch, Band-Aid, and then you get this special activity. Okay. So this is something that we've created because we know exactly what our steps are here at Johnson Center. If your steps are different or if you need to implement anything differently, you can use create your own social story using age-appropriate terminology and developmentally appropriate terminology. So again, we will just be talking about some preparation here. And this is more geared toward clinicians and to parents, but it's how to explain to children what to expect. You want to use honest and developmentally appropriate explanations to help your child understand. So it's what you say and how you say it. It's important to remember that language can be harsh and scary depending on the words that you choose. So think of ways to communicate using non-threatening words. So for example, instead of saying, tomorrow you're going to the hospital or tomorrow you have a doctor's appointment, you can make it more personal and say, tomorrow we are going to go see your friend Anna, who may be their nurse that they are familiar with. Try using accurate information and avoid white lies. It's never productive to lie to a child or to give them a sense of falsehood. This typically increases a child's fear once they realize they've been lied to. And in some cases, parents or clinicians may feel like the less the child knows, the better, and this may be true depending on the patient. Explaining the event or talking about the experience may actually be less productive to a child that is already overly anxious or fearful. So what's important to keep in mind as caregivers and clinicians is to be able to accurately assess a child's level of anxiety to be able to determine the most appropriate method of preparation. So you want to explain what is happening during the procedure using clear and direct language, and your healthcare provider may assist you in this. For example, like we mentioned before, when applying the tourniquet, you can use language like the rubber band, and again describe what the rubber band or tourniquet is used for. So when the nurse puts the tourniquet on, you can say that it feels like a tight squeeze and the rubber band is giving the patient's arm a strong hug. These associations can help children relate to the experience while also educating them on the medical supplies that are being used. It's important to provide positive comments and praise to your child for completing the procedure. Verbal praise can be extremely reinforcing. You can also have something like a certificate or a gold star ready to give the patient after they're done with their blood draw. And a great idea would even be to have the nurse or a child life specialist sign the certificate beforehand and present it to them when the patient is done. That way they're getting something special from the team. When possible, provide choices to increase the patient's sense of control, and we talked about that a little bit during our social story. So giving them options on what Band-Aid or wrap they choose. Ask the child to pick out which coping technique they would like to use to stay calm. Depending on the child's developmental age, providing choices can make a significant impact in their ability to cope with their experience. We know from a developmental standpoint that providing choices helps to create opportunities for children to gain control over the experience in their body and to help them identify what their role is. So now that we've kind of given a brief overview on some tips that clinicians and caregivers can do before the visit, we will dive into what you can actually do during your visit. So there are several coping techniques that parents and clinicians can utilize during the visit. Some of the tools that we mentioned previously, such as the social story and visual schedule, can also be used during the visit. So a lot of these can kind of flow over prior and then during and then maybe even after, and we'll talk about that later. So next we are going to discuss some additional tips and suggestions that can provide support during that potentially stressful experience. The first is guided imagery, and we have here the example of a magic glove, which I'm not sure if anyone is aware of, but we'll talk a little bit about that. So during the procedure, you can help your child visualize a more pleasant experience. You can talk to your child about different sounds, smells, pictures, or places to distract them from the medical procedure. So while the experience is going on, while the blood draw is happening, if we have a caregiver or another team member there kind of prompting that imagery, and if you have a child that you know already has an avid imagination, you can build off of that. And detail is important. So if you know a child likes going to the beach, talk about what the sand feels like. Talk about what the water feels like. Talk about what the sun feels like, if it's warm, if you're in the shade. The more visual, the more detailed, the better, because it's actually taking time, your mind time away to make this experience a little bit more accurate. The magic glove is something that is a very detailed guided imagery experience where you talk about all of those things. You talk about what the glove feels like, what it looks like. To a different child, depending on the child's age or gender, it can be used for different things. And you want to do this beforehand, and that way when in the clinical room or during the procedure, you talk about how you transitioned that magic glove to that experience and what it feels like here, and reinforce what the child gave you. So if you know that the child said it was purple earlier, reinforce, is it still purple? What shade of purple is it? Deep breathing can really help. So when your child is tense or anxious, their veins actually become smaller and harder to find, a little bit constricted. So long, deep breaths can help the patient to relax. And you can ask your child to imagine blowing up a balloon or counting their breaths. Again, so some imagery. You can also help your child focus on relaxing different parts of their body. It's best to try to practice relaxation techniques before the medical appointment, and you can describe relaxation in terms that children will understand. So try stretching like a cat. Again, I want to go back to how important it is to describe in detail. So you can imagine relaxing your fingertips, imagine relaxing the palm of your hand, and then your arm, and then your shoulder, and then your stomach, and then your legs. And by the time you're down to your toes, your blood draw may already be over, and your child has completely been distracted by the areas of their body they're trying to relax. Again, it's important to practice this beforehand so that they know what to expect, and you know whether or not this is a successful coping technique. And it's best to use these strategies when your child is calm instead of trying to use the strategy after they've already become visibly upset. It's a lot harder when they're already agitated and anxious. So be proactive. Definitely talk about these things before your visit and then implement them during your visit. And here we've outlined the visual schedule that we used during our social story. This can help children understand and become comfortable with the steps of the medical experience. And it's important because we'll go back to the challenges that children with autism may face, which specifically can be routine. Our children can be very routine-based, and so this visual schedule can help them to prepare them for changes in their schedule. It can provide them with tools to understand their experience in small steps, and we are allowing them to anticipate transitions and to feel secure in the schedule. So you can review the schedule at home before the procedure and then again while you wait for your appointment. And you can also create your own visual schedule or binder or picture story by using specific photographs that you've taken from a prior visit, and then with Velcro you can outline and kind of put through what you've already done or what's next. The next procedure support that we'll talk about is the use of distraction. So bubbles can be a great hit for children of all ages and genders. If possible, you can even fill your clinical room or your procedure room with bubbles, and then when patients walk in the room, they are less likely to feel anxious about the experience, and they may also associate it with a positive room so they can remember it as the bubble room. That way the next time they come back, they remember this as being the room that was filled with bubbles and it was magical. You can allow the patient to blow bubbles during the blood draw, and you can practice blowing small or large bubbles and then count how many bubbles the child blows. Again, it's getting them to focus on something different, focus on something positive, something that they're comfortable with, something that they've mastered before. And then again, it's giving them the role. You can start by blowing the bubbles to them, and then you can let them blow the bubbles, and under the understanding that it's going to be their role while we are while the nurse is looking at the arm, the child can blow bubbles. So it's giving them some expectation. You can use sensory items like a cold pack or a vibrating toy. Sensory items, especially toys that vibrate, can help younger children cope through the experience. So prior to a blood draw, you can put a toy that vibrates on the location, say it's going to be the arm or the hand. That way the child becomes acclimated to the feel. You can use pinwheels to help increase deep breathing. So again, just to reiterate, when our muscles are tense, our veins may constrict and become harder to find. So by practicing deep breathing, the muscles relax, and it can be a potentially more successful experience for everyone. Squeeze balls can help patients to release their stress in a healthy way. For hard sticks to the hand, a stress ball can also help the patient become comfortable by having something to hold on to. And you can use their favorite toy. So encourage your child to bring their favorite toy or object into the procedure room. And this transitional object can help your child feel a sense of comfort and to decrease their anxiety. You can encourage your child to participate in an activity during the procedure. So they can read a book, watch a movie or a video, or sing a song. More recently, many families have used an iPad or an iPhone to aid in distraction. There are many applications right now that are free of charge and very interactive that can be used for children on the spectrum. And so you can use these interactive games or applications while the patient is during their experience. That way they are momentarily focused on something else besides the procedure. So why does it matter? When children think about going to the doctor, many may become worried or anxious. And distraction can help by taking your child's mind off of the stressful event. They may help put attention on positive thoughts, our activities, our experiences, and this helps make the experience more successful, and then like I mentioned before, it helps make future experiences more successful as well. So what's important to remember with these coping strategies are to consult with your clinician regarding what works and what doesn't work. So if you know that the child is going in for a blood draw, not only should you talk to your healthcare provider about what you've implemented in the past, that way they know what to expect, but you should also talk about what doesn't work, that way they know and the team members already have an understanding of what not to use. So you can review past medical history and create a plan for the day of the procedure. And creating that plan also helps you with the visual schedule and the social story. So it kind of all comes together as long as there's communication between the caregiver and the clinician. And so here we will talk about comfort positioning, which we touched briefly on the social story. And if you can remember, this is our lovely patient from our social story, and he's exhibiting some comfort positioning with his caregiver. And this is, you know, it's a really helpful tool. Here is a quote from a child and says, "It makes me feel better when I know mommy is holding me." Again, it's just it's a support service that can be used, and it integrates the caregiver into the role, which is really helpful for family-centered care. So positioning for comfort is a comfort measure used to introduce comfort and control the patient during medical procedures. Ask your healthcare provider about different positions that may be helpful for your child. And so we know that typically caregivers are asked to hold their child in different positions. This can help with coping, but also help with the safety of the patient, parent, and clinician. So there may be some helpful positions that your nurse or clinician is aware of that you may not be. So it might be beneficial to talk to them about what they have experienced in the past and things you can implement for your child or for the patient. So why should we provide positioning for comfort? This helps to involve a safe and secure hold from the caregiver. For children on the spectrum, again, they may not have that, or they may have a challenge with communication, and so the fear may be increased by their inability to communicate why they have to be held down or to understand why they have to be restricted. So if instead we ask them to just give a caregiver a hug or sit on their lap, this is something they're already familiar with, something that they can understand. So it helps. This offers more comfort for the child and increases the chance of a positive medical experience. And again, we talked about incorporating family-centered care and providing a sense of control. So now that we've talked about different techniques that we can use prior and then during, what I really want to emphasize is the language that's used during the course of all of those different support services. How do you explain and prepare, and what do you say to a child during? So again, it's what you say and how you say it, and these are the examples that we touched on earlier. So applying the tourniquet. This part feels like a tight squeeze, and it helps the nurse find the best spot. So we're talking about what it feels like and what its purpose is. Cleaning with an alcohol wipe. We use a wipe to clean the spot. It may smell funny and can be cold and wet. Same thing. We're talking about what it feels like, what it looks like, and then the purpose. And then the most important one that I think we all want to kind of dive into is how to talk to a child on the spectrum about the blood draw. So this is the wording that we have used. You can adapt or modify it depending on the child's developmental understanding. So we have kind of outlined here what to expect. So we are going to use a small poke to help the straw find the blood. It's important to be still like a statue while your nurse looks for the best spot. Can we practice staying still? Once we find the right spot, we will be able to use the poke, and then the small straw will help find your blood. The poke comes out and the straw stays in. Different clinicians and different support services or team members use different wording. What's important here is just that it's non-harsh and non-threatening. So we're using we've replaced the word needle with poke. You can use something that is less threatening, or you can explain to an older child what the needle looks like, or you can use the word needle if they're already familiar with that, and they have a concept of what it's used for and they're not fearful. Now, if that word that you know is fearful, it's not something that you want to emphasize. But again, you do want to be honest, so you want to make sure that they understand that something will feel like a tight pinch or poke, but then only the straw or the catheter will stay in. So, and then the important role that we've played here is what to ask a child to do. So we ask them to stay still, and then we practice staying still. And we have addressed it in a way that they can practice staying still like a statue, so they know what to compare it to. So if we have a child that we know does have some fear or anxiety, and as a caregiver we have already talked to our team members about that fear and anxiety, so they know and they are prepared for that, one thing that we can do across the board is implement some type of intervention to address that fear. And one way we can do that is through medical play. So medical play allows the child to freely explore materials that will be encountered during the procedure. It can be led by a child life specialist and then supported by a caregiver. It gives the patient opportunity to release emotions and can be used prior to the procedure and again after the procedure. And it can be child-directed. So what we've done here is outlined a scenario in which medical play was used in a clinical setting. Heather is a 3-year-old with autism spectrum disorder. She has significant anxiety during blood draws. So to address the concerns, our nurse and child life specialist provided medical play prior to the blood draw. Heather is introduced to the tourniquet and allowed to play with it freely. She uses the tourniquet to wrap around father's arm, then nurse's arm, and then finally allow the nurse to wrap the tourniquet around her arm. Heather becomes anxious as she sees the medical wrap. Child life specialist tears a piece of the wrap and puts it around a stuffed toy. Heather uses a piece of the medical wrap and puts it around the toy's leg. Heather then allows the nurse to put the wrap around her arm. So what we're talking about here is introducing them to different medical supplies that way they can become more familiar with it. And it is playing with it in a way that they are comfortable with. Again, letting and allowing Heather to use the tourniquet in ways that she may have not used before, so putting it on a stuffed toy. And then again with the medical wrap, it's being able to practice and do it on dad, who she trusts, and then on nurse, and then on child life specialist, and then finally on herself. So medical play can be done in a clinical setting, but it can also be done at home. And here's a scenario in which it was implemented in a natural setting. So Michael is a 6-year-old male with autism spectrum disorder. Mom has noticed that with the increased medical visits, he is becoming increasingly anxious. She uses a play medical kit to help Michael act out his experience. As Michael becomes more familiar with the items such as the alcohol wipes, Band-Aids, and tourniquet, he is less anxious when he sees these items during his next appointment. So again, it's just becoming familiar and it's practicing it at home. That way when Michael sees that in the office, he's already played with it. He already has a good understanding, and so he's less fearful and anxious when he sees those during the procedure. So now that we've talked about a general understanding of preparation and appropriate language, we can talk about reinforcement and reward. So what we can do to reward that experience, to reward after they've had a successful blood draw, they have positively coped through the experience, emphasizing what a great job that they have done. Again, verbal praise can be very motivating. And it's important to remember to give the reinforcement as soon as you can, or provide a visual schedule to remind the patient of the reward that's following. Be clear about what your child needs to do to earn their reward. And that's really important because some of our kids may jump to the end and they want to do the reward if they just sit on the chair or if they just do what they're told initially. So the visual schedule helps us kind of take it in steps and make sure that it's outlined exactly what needs to happen. And be prepared to follow through with the reward. So we don't want to, again, give a sense of falsehood or expectation and then take it away. And that can be, that can make future experiences less successful. Okay. Pain management. So research shows that stress leads to increased tension, which contributes to higher levels of pain. So if we know beforehand that a child is anxious or stressed going into a blood draw, that pain level is something that we're going to need to address. For a child on the spectrum, again, this is something that we really need to consider because they may not have the verbal ability to be able to communicate their pain level or intensity. So by addressing or implementing some type of pain management, we can help to address those areas of concern. So you can use a topical cream or a spray and then describe that spray and make sure that you prepare the child for the cream or spray because that in itself can be something that's very intimidating. So explain what the spray is going to feel like, what it's going to smell like, it's not going to hurt, and then even talk about what its purpose is again. So once we put on this spray, this is going to help us to not feel the pinch as much or to feel the poke as much. Some kids say they don't even feel anything once we put on the spray. You can describe, depending on the child's imagination and creativity, that it's a magical spray. So it can really be used not only as a pain management technique, but also as distraction. Get them involved. Ask them what it smells like and what it feels like so that you can explain it to other kids when they have to do it. And tips for clinicians. So a lot of times as a primary care provider or a clinician, we may not have considered some of these areas of concern that we've addressed today. Some of the things like a child's level of understanding of the experience or how stress and anxiety can contribute to that experience. So these are things that we can do as providers to help a child cope through that experience, and then overall it would be a more successful encounter for the parent, the patient, and ourselves. So as a clinician, we should engage the child in ways that are playful and positive, get a good assessment of the anxiety level, and again, one way to do this is to talk to the parent. You know, have a general understanding of what their anxiety level is beforehand. That way we know what strategies to put in place. Again, what works, what doesn't work, their level of understanding, so we know how to appropriately explain the procedure. And then to emphasize that this is an experience, not a protocol. And that's something to emphasize to ourselves, to remember every time we have an interaction with a child. And this is something that as we practice, we may not remember all of the time. We may see this as another appointment or our third appointment of the day. But for a child, this is their first appointment of the day. This may be their first experience of their life having a blood draw. This may be their third time having a blood draw, and the first and second were extremely traumatic, and now you are walking into experience you may not be prepared for, and the child may be highly fearful. So one way to avoid all of those different scenarios is talking to the caregiver and having a general understanding of what to expect so you can prepare. But then also being interactive and communicating during the experience and talk to the child so that way you can get a sense of how they're feeling, what steps we need to take, what their misconceptions are. And then this will alleviate some of the stress and anxiety not only for the patient but for the parent, and that is extremely important to remember as well, because as parents and caregivers, if they are highly anxious, their child is going to sense that anxiety. Their child is going to sense that stress, and they may experience that stress just due to their parents' level. So if we talk to parents and we have a plan put in place, that can help us overall have a positive experience. Other tips are to involve child life specialist or a social worker or a caregiver. So bring in another team member, somebody, if you know that you are, or if someone else has a better understanding of what to expect and strategies to use, you can involve them in the experience as well. Parents are typically present throughout the interactions and can serve as a source of information both for the child and the clinical team. So parents know their child best, so involve them. And again, that preparation can help, and they should be included as a vital member of the healthcare team. So we're running a little long here, and I do want to save some time for some questions. I do have some more information, and I apologize if I don't get to it all, but I do want to just have an overview of some of our tips from our nurse on what you can do in terms of things that you have to complete at home. So lab tests or stool tests. So let's see here. So tips for stool testing. I know a lot of parents may have some trouble with this type of test, and so it helps that you have some tips outlined for you. So one thing that you can do is urinate before collecting the stool specimen, stretch saran wrap over the back half of the toilet, under the seat. We've kind of just outlined some tips and tricks here that you can use. And then also asking questions to your clinicians and see if they have any tips or tricks beforehand, and making sure that that open communication is there, that you have somebody to talk to. For urine testing, if it's first morning urine, place collection cup in the restroom the night prior to the collection. And again, ask questions. And why test? So lab testing provides the clinician with data and information they need to make appropriate recommendations. And I think what we want to outline here is how important it is to understand why you're doing certain tests or what recommendations are, and to keep that communication open between your clinician and yourself. Which is what we kind of outline in the next slide. So connecting with your healthcare team. By connecting with your healthcare team, this helps your child see the medical staff as helpers. You can designate a transitional person, a nurse or child life specialist, to help throughout the visit. And you can problem solve coping strategies with healthcare members. They may have some ideas that may have worked with previous patients. So it's really about being honest as caregivers about your concerns, and then as clinicians being helpful to add or to address some of those concerns by different strategies that have been used in the past. And then just a list of our references, and if you wanted any additional information, you can email us or visit our website. The social story is there along with a couple of other picture stories that you can use as a reference or guide in creating your own social story. So what we're going to do now, and thank you for your time and attention, I do have some time to answer any questions that you may have. So let me just go ahead and pull up some of these questions that are coming in. And let's see. Okay, so one of our first questions is, what advice would you give a parent who is looking to encourage their local clinic to become more ASD friendly and embrace some of the strategies you have discussed here? So I think the first step is to talk to the team member there that you feel comfortable with, and start by, like we mentioned today, the challenges that children with autism face that are different. Different things that need to be addressed, like clear communication, a need for routine, All of those are simple to put in place, but sometimes as a clinic that is not aware of those certain challenges, they may not see that as something that they need to integrate. So if they know that there's a need and they understand what that need is, it may be easier to help encourage them to make those modifications. And then what you can do is actually implement some of your own strategies, and when you're making appointments, say, this is something that my child's comfortable with. Are you comfortable with me bringing in a toy or bringing in bubbles or bringing in somebody to help distract, because it's really going to help. So it's something that you also take on a role and become an active member in that experience, and to acknowledge that you are bringing in and implementing these strategies yourself. And if you do that, and if it is a positive experience, that can just open the doors to that clinic so that they see that you have kind of integrated this and it's been successful, and then they can use that as an example to future patients. Okay, the next question is, how do you help your child in the actual blood draw if the storybook does not work? We have tried this approach and are still experiencing extreme meltdowns. So this is why it's helpful to kind of implement different coping strategies. That way you exhaust what works and doesn't work. Every child is different, and some of these strategies won't work for all of them. The storybook, and I do have just some follow-up questions. So if the storybook is used during the visit but not prior, that can be something that you implement. Also, consistency in the storybook, so using it the night before, the morning before, during the visit, and then again after the visit. Those are just some ways if you want to continue to try and modify using a social story. Other things to implement are different coping strategies. So like we said, comfort positioning. There really is the need to understand what's causing the anxiety. It could have started with initial misconception, and it's now built off of various negative experiences. But there had to have been one reasoning initially that caused the fear. And so to understand that can be helpful in determining the best coping strategy. Also, having several rewards or reinforcers can help. And understanding what works for your child and what doesn't. So if they do have a movie, or they have something like an iPad that's reinforcing, bring that or talk to your care provider about implementing that. That way you have several different strategies put in place, and if one works, great. If it doesn't, let's move on to the next. The question was also, cream that numbs the skin, what is that called? And I can talk to our nurse about that. And I can get that to you through your email. I am pretty sure that I want to say it's EMLA, but I do want to just clarify that with our nurse. And yes, it is EMLA, and that can be used prior to the blood draw. Okay, so it looks like we're out of time. There are a couple of questions, and I can address those through email, or if you want to give us a call and you had any additional follow-up questions, I'd be happy to talk with you. We do have some tips and tricks on our website under Child Life Tips on what to do before, during, and after, and how to contact your healthcare provider. So if you had any additional questions, you can call our office or email us. Again, thank you for attending. I hope that this information was helpful and that you are able to implement some of these strategies that we have discussed today. Thanks.
The organizer has ended the session, and this call will be disconnected. Goodbye.